What happened to hemoglobin A1C? The blue bar at the bottom is our intervention, the two intervention groups together. The black line at top is the group of patients who were in the usual care. And it's a standard understanding that type 2 diabetes is a chronic progressive disease, and these people, hemoglobin A1C was slowly going up even in the course of 2 years. And it depends on whether you talk about remission. We like to talk about reversal, because remission sounds like you got to a destination, and I like the term reversal because it means you're going back in the right direction towards metabolic health. By reversal means we take them off all their diabetic medicines except metformin. And we had 55% of people at the end of 1 year who had reversed their diabetes by those criteria. This shows medication use. It's kind of complex, but on the far left-hand side is our sulfonylureas and insulin. The sulfonylureas we completely withdrew because they're very dangerous drugs, inducing hypoglycemia. 54% of the patients stopped their insulin. Almost 40% reduced their insulin. Drugs in the middle were drugs that we didn't regard as dangerous and weren't as active in reducing them. And on the far right-hand side, you see metformin. If the people were on metformin and had no side effects from it, we did not stop it. But I think there are ethical issues of stopping a drug that isn't having side effects, that's very cheap, and which has known benefits of preventing progression to diabetes. Because this cohort of people are at very high risk of progressing to type 2 diabetes, so we don't stop it. This is a eat to satiety study. It was not a calorie-restricted diet. We weren't focusing on weight loss. But this shows you the weight change for the two cohorts across 2 years. And you can guess that the blue patients are the ones who were on the Virta program. And we had progressive weight loss down to 1 year. We did not see, as a cohort, the group begin to start regaining some weight till about 14 months. So there is some weight regain that we saw in the second year, but it was very modest compared to what one sees in a lifestyle program. But we saw a 12% reduction in 10-year atherosclerosis risk based on a standard predictive equation. One thing that, the blue bars are, anything going up is improvement, reduced risk, anything going down is increased risk. The only blue bar going down, which is our intervention group, was LDL cholesterol. If you look over here on this side, this is the small, dense LDL, the atherogenic LDL. It improved, even though LDL slightly increased. The other thing I'll point out is, with the purple bar over there, that's C-reactive protein. At 3 months, it doesn't go down. And in this study, I won't show you, CRP did not go down in the first 70 days of the study. But at 1 year, we saw a dramatic improvement in CRP, and also an improvement in white blood cell count right next to it, which are both recognized predictors of diabetes risk and heart attack risk. But these are 16 biomarkers of inflammation that we measured at 1 year and 2 years in this population. Here we've got 14 out of 16 going down. And if you're into statistics and you want to say, well, how powerful is that? All 14 of those 16 that we say went down significantly, the p-value was 0.001 or less. And so what we're looking at here is a broad spectrum anti-inflammatory intervention. If you take an anti-inflammatory drug like the modern statins reduce CRP. They'll reduce it about 25%, but it has no effect on other biomarkers of inflammation. It's a single-focused drug. This is a much broader perspective.
Stated and summarized, easy to share with loved ones. The description below the title for this video has these summary points.